Hello, I gave this talk recently. I wanted to record it and put it up on my YouTube as a helpful tip for how to determine pain versus injury and what to do about it. So, true or false? This is a question here. Are pain and injury synonymous? Sometimes you may feel like they are. You may feel like you've been injured if you've been in pain for a certain amount of time, but it is false. It's actually quite common to have pain without an initial injury. In fact, 95% of back pain is not caused by any identifiable problem in the muscles, tendons, ligaments, bone, or discs, and it's referred to as nonspecific low back pain. Injuries can occur in the presence of trauma. So think fall, trip, car accident, or sports injury. It often involves body parts that are broken, stretched, torn, or damaged. Most commonly, injuries happen when someone does too much too soon. So think of the weekend warrior, where tissues are repeatedly stressed by a load beyond their capacity, and they're not given enough time to recover. So tissue injury normally has certain types of healing times. So muscle strain is 3 to 6 weeks, fractured bone 6 to 8 weeks, herniated disc 3 to 12 months, surgically repaired meniscal tear 6 months, and Achilles tendon tear 12 months. I see there's a typo there, under repair. But this gives you an idea of if you've been dealing with a certain injury and it's past that tissue injury time frame, and there might be something else contributing to your pain besides the actual tissue damage. So, what do you do when you have a soft tissue injury? So, we'll look at immediate care and management. So, this is moving beyond RICE. You may know RICE as rest, ice, compression, elevation. And so now we're looking at peace and love for soft tissue injury. And I'll get that into the next slide. But immediate care is going to be the protection, elevation, avoid anti-inflammatories, compression, and education. And management is load, optimism, vascularization, and exercise. So we're going to give peace a chance. This is how to deal with tissue injury. First, you will unload or restrict movement for about 1 to 3 days. This can minimize bleeding and reduce the risk of future injury or further injury. So prolonged rest, however, delays healing. So think about your recent ankle sprain. You will unload it for a few days, but eventually you want to start loading it again. E is for elevation. So this is valuable when swelling has occurred. A is for avoiding anti-inflammatories, especially in the long term. They can negatively affect tissue healing. C is for compression. So think of compression when there is a certain amount of swelling. Compression can be an effective tool for injury management. E is for education. So active recovery is more beneficial for long-term healing than passive recovery. Passive is any type of modality that is happening to you versus an active role of moving your body. So you want to be educated that it is safe to move again. Okay, then all you need is love. L is for load, optimal loading. Think standing on your foot after an ankle injury. This promotes repair. It promotes remodeling and building tissue tolerance, and it helps the capacity of the tendons, muscles, and ligaments. O is for optimism. Your perception on the threat of injury matters. Are you afraid to move, or are you a movement optimist? Beliefs and emotions are thought to explain more of the variation in symptoms than the degree of the tissue injury itself. So, tissue injury severity does not correlate with a specific subjective report of someone's pain, but actually your beliefs and emotions surrounding the injury will explain more of that symptom variation. V is for vascularization. Aerobic exercise with minimal pain should be started a few days after injury to boost motivation and increase blood flow. And then E is for exercise. Gradually loading an exercise injured body part will optimize tissue healing, recovery, and optimize your confidence to use your body again. So what happens when you have pain in the absence of an injury? Well, pain is best thought of as a protection alarm, not as a danger alarm. So pain alarms can be triggered when mental or physical resilience is low or when your brain perceives danger. This makes your pain system more sensitive to protect you. Pain needs to be thought of as multifactorial and not due to one specific cause. So, how do you care for pain that is non-traumatic? Well, self-care. In the absence of trauma, do not assume that pain indicates tissue damage. X-ray and MRI are only necessary when suspicious of serious pathology. Explore other factors that contribute to pain, like sleep, stress, diet, activity, social connection, and past history. Stay positive about your capability and resilience. Improve tissue tolerance through load, i.e., stay moving. And work with a movement professional who encourages your own self efficacy and helps you devise a plan to meet your goals. So, this takes you to what can be called a pain recipe. This is not my term. Dr. Rachel Zofnis is the one that I heard about having a pain recipe, but I want to think about it this way. What is going on in life when pain is at its worst? So you can think, am I sleeping poorly? Am I stressed at work? How's my diet? Am I sedentary? Am I isolated from friends and family? Do I have negative thoughts and beliefs regarding this injury or regarding this pain? And then develop a decreased pain recipe. So, what can you do to improve all of the factors surrounding pain? Sleep 8 hours a night, engage in stress management, eat real food, move daily, connect with friends and family, and adopt a growth mindset. So, these are the things in my wellness cycle here, considering mindset, breathing, stress, sleep, nutrition, and movement that all play a key role in improving someone's pain. So, I hope that helps, and thanks for watching.